Right now, in hospitals across America, something is happening that nobody wants to talk about. A senior walks through the emergency room doors or checks in for a planned procedure. They're worried, maybe they're in pain, and they're handed a clipboard. Within minutes, they've signed away protections they didn't even know they had. 3 weeks later, a bill arrives for thousands of dollars from a doctor they never met. Or a month after discharge, they fall at home because they were sent home too early, and now they need expensive rehabilitation they can't afford. Or they're billed tens of thousands of dollars for a skilled nursing facility stay because the hospital classified them as something called observation status instead of an actual admission. I'm Dr. William, and I've spent the better part of 2 decades watching this happen to intelligent, careful people who did everything right and still got financially devastated by a system they didn't understand. What I'm about to tell you has the power to save you more money than almost any financial decision you'll make in the next decade. And the protection is so simple, so straightforward, that most people can't believe they weren't told about it the moment they walked into a hospital. But here's the thing about hospitals: they're not required to tell you these things. There's no financial incentive for them to make you aware of your rights. In fact, when hospitals operate in this gray area where patients don't know what to say or what to ask, it works in their financial favor. So nobody teaches seniors this information. Nobody hands you a card with 5 sentences that could protect you. That's what I'm doing right now. These 5 sentences, once you understand them, once you commit them to memory or write them down and carry them with you, will fundamentally change how you experience healthcare for the rest of your life. Let me start with something that happens to nearly 1 million Medicare patients every single year, and most of them have no idea it's occurring. A senior goes into the hospital feeling relatively secure. They've checked their insurance. They know the hospital is in their network. They feel prepared. Then 3 weeks pass. An envelope arrives in the mail. Inside is a bill for $2,000, $3,000, sometimes $5,000 from a doctor they never even spoke to. Maybe it's an anesthesiologist who was in the operating room. Maybe it's a radiologist who read their imaging. Maybe it's an emergency room physician who saw them for 15 minutes on intake. The hospital was covered. The building was covered. Everything about the facility was in network. But these individual doctors, these specialists who contract separately, they were out of network. So suddenly the patient is responsible. This happens because hospitals employ specialists on contracts, and those specialists sometimes have their own separate network agreements with insurance companies. The hospital doesn't control which networks those doctors participate in, and the hospitals have very little incentive to tell you about this potential problem in advance because it doesn't affect their bottom line. It affects yours. This is called the out-of-network specialist surprise, and it's been bleeding money from seniors for years. But something changed. There's a federal law now called the No Surprises Act. It was passed specifically to protect patients from exactly this situation. And it gives you a legal right that almost nobody uses because almost nobody knows it exists. The moment you arrive at any hospital, any surgical center, any medical facility, before any procedure, before any specialist even walks into your room, you have the right to say these exact words to the staff or the billing department. Write this down right now. I only consent to treatment by in-network providers under the No Surprises Act. That one sentence, spoken or written and documented, puts the hospital on legal notice. If they bring in an out-of-network specialist after you've said that, the financial responsibility shifts from you back to them. They have to either use an in-network provider or they have to get your explicit permission in advance, which means you can negotiate or refuse. This single statement has saved people thousands of dollars. I've watched it happen. People use this one sentence, and suddenly what would have been a $5,000 surprise bill gets negotiated down or disappears entirely because the hospital handles it through their insurance instead of billing you directly. Now let me tell you about something that doesn't involve paperwork at all. This involves a doctor coming into your hospital room, a rushed conversation, and a decision that gets made when you're at your absolute most vulnerable. Hospitals across this country operate under constant financial pressure. Insurance companies push them to move patients out of beds as quickly as possible because every day in a hospital bed costs money. There are financial incentives at every level to discharge patients faster. What that sometimes looks like in real situations is a patient being sent home before they're actually ready to leave. A doctor comes in and says you're doing well enough to go home, and because it's a doctor saying it, most people just accept it. They get dressed, they pack their things, they go. 3 days later, they fall in the shower. Their wound isn't healing right, they have a complication. They end up back in the emergency room, which costs 5 times more than if they'd simply stayed in the hospital for 3 more days. This is called premature discharge or rehab dumping. And the tragedy of it is that most seniors don't realize they have a legal right to appeal a discharge they believe is premature. That right exists right now. You have it. You've always had it. Most people just don't know to use it. Here's how it works. If a hospital tells you it's time to go home and you don't feel medically ready, or your family doesn't feel you're ready, you can request an expedited appeal through something called a Quality Improvement Organization, a QIO. You can find your local QIO at medicare.gov. Once you file that appeal, the hospital cannot legally discharge you while the review is being processed. You're protected, you stay in the bed, you get the care you need. The key is simply knowing to ask. The words you say to your care team are simple. I don't feel medically ready for discharge, and I am requesting an expedited appeal through the QIO. I know a woman named Margaret who was 71 years old and had a hip replacement. On day 2 of her hospital stay, the physical therapist did a quick evaluation, and her doctor immediately suggested discharge the next morning. Margaret's daughter asked the nurse something that changed everything. Can we speak with the case manager about requesting a QIO appeal? That one question changed the entire tone in the room. The discharge was delayed. Margaret spent 2 more days in the hospital doing her physical therapy properly. When she got home, she told her daughter, I would have fallen the first night. I absolutely would have fallen. She was right. Without that extra time, she would have been injured back in the emergency room, far worse off. That's what happens when you know what to say. There's a third trap that starts before you ever leave your home. It's about medication, and it's more dangerous than most people realize. When a senior is admitted to a hospital, that hospital operates its own pharmacy. That pharmacy has something called a formulary, which is essentially a list of approved medications they stock. The maintenance medications you've been carefully taking for months or years, the blood pressure medication that took months to dial in just right, the thyroid medication where getting the dosage wrong makes you feel terrible, the heart medication that you've been stable on, that medication might not be on the hospital's formulary. So they substitute it, they use a different brand, a different generic, a different version, and they do this sometimes without clearly telling you. For adults over 60, this is not a minor inconvenience. The cardiovascular system is sensitive to these medication changes. You can experience dizziness, blood pressure swings, irregular heartbeats, real adverse effects that matter for your recovery and your safety. On top of that, the hospital pharmacy charges premium rates for these substituted medications, so you pay more for something that may not even be the right thing for your condition. The protection is simple. Create an updated list of every medication you take. Write down the exact brand name, the exact dosage, the exact time you take it. Carry this list with you. When you're admitted to a hospital, hand that list to the admitting doctor and say clearly, do not substitute or alter any of my maintenance medications without explicit clinical review and my written consent. That puts the responsibility on the clinical team to bring any medication change to you, discuss it, and get your agreement before they do it. This simple step prevents errors, prevents adverse effects, and protects your recovery. Now I need to tell you about something that happens in the first 10 minutes you're in a hospital, when you're scared, when you're confused, when you're in pain, and someone hands you a clipboard and asks you to sign. This is the trap that blindsides more seniors financially than almost anything else, and most people sign away their protection for it without even realizing they're doing it. Walk into any hospital in America, and within minutes you're handed a stack of forms. Consent forms, privacy forms, insurance authorization forms, and somewhere in that stack, sometimes buried on a separate page, sometimes hidden in a longer document, there's a clause that says you assume all financial responsibility for services not covered by insurance. Most people sign it without reading it. They can't read it carefully, they're worried, they're in pain, someone is waiting for them to hand the clipboard back, so they sign. And what that signature does is give the hospital the legal right to bypass normal insurance negotiations and bill you directly at full inflated rates for anything Medicare or your insurance doesn't cover in full. This is called balance billing. And it can mean tens of thousands of dollars in charges that your insurance would have negotiated down to a fraction of what they're billing you, except you already signed away that protection. Here's what you do instead. Before you sign any financial responsibility form, take a pen and write this exact phrase right next to your signature. Not instead of signing, but right next to it. Right, signing only for authorized insurance benefits, not personal financial liability for uncovered balance billing. You can write it in pen. You can do it right there in front of the intake person. It's legal, it documents your intent, it protects you from having that signature used against you later. If you have anyone in your life over 65 with an upcoming procedure or a surgery scheduled, take a photo of that sentence right now and send it to them. When they understand what it means, they'll understand it could save them thousands of dollars. Now I need to tell you about the trap that changed everything for a 68-year-old man named Robert. He had absolutely no idea it was happening. 3 out of every 10 Medicare patients admitted to a hospital each year are placed under something called observation status. That's hundreds of thousands of seniors every year. Under observation status, a patient is technically classified as an outpatient, even while lying in a hospital bed, receiving specialist care, eating hospital meals. being monitored 24 hours a day. But here's the financial trap. Medicare Part A, which covers rehabilitation and skilled nursing facility care after a hospital stay, only applies after a formal inpatient admission of at least 3 consecutive days. Observation status does not count toward that 3-day minimum. Not one single hour, which means a senior can spend 4 nights in a hospital, get full treatment and specialist care, and then when they're discharged and need rehabilitation, they get a bill for the entire stay out of pocket. Tens of thousands of dollars. Because on paper, Medicare never saw them as an actual admission. They were observation. Robert came to the hospital with chest pain and fluid around his lungs, classic signs of something serious. He spent 4 nights in the hospital. He had a bed, a care team, multiple specialists. He assumed he was admitted. When he was discharged and his wife called about rehabilitation, they were told he'd been under observation status the entire time. The rehabilitation bill came to over $22,000. When I sat with Robert, he said something I'll never forget. He said, "Nobody said those words to me once, not even once. If someone had just told me, I would have asked them to change it." He was right. He should have been told the moment he arrived. And now you know what to say. The moment you're placed in a hospital bed, ask the doctor or case manager directly, "Am I admitted as an inpatient or am I under observation status?" If the answer is observation status, say this: "I am requesting that my status be reviewed for formal inpatient admission based on medical necessity." That request goes in the record. The care team has to respond to it. In many cases, when a patient explicitly asks, the status gets reviewed and changed. The law also requires hospitals to give Medicare patients written notice of their observation status. It's called the MOON Notice, the Medicare Outpatient Observation Notice. If you haven't been given that notice within 36 hours of arriving, ask for it by name. "Have I received my MOON Notice?" Those 5 words tell the hospital you know your rights. So here's what I need you to do in the next hour. Don't wait. Don't think you'll do this later. Do it now. Take a piece of paper or open the Notes app on your phone. Write down these 5 sentences. Am I admitted as an inpatient or am I under observation status? I request my status be reviewed for inpatient admission based on medical necessity. I only consent to treatment by in-network providers under the No Surprises Act. Do not substitute my maintenance medications without explicit clinical review and my written consent. Signing only for authorized insurance benefits, not personal financial liability for balance billing. 5 sentences. That is your complete protection plan. Keep it somewhere you can find it fast. For the next 30 days, commit to this. Every time you have a doctor's appointment, every time you see a specialist, every time you or someone you love walks into any medical facility, have that list with you. Review it before you go in. In 30 days, this will be a habit. You won't have to think about it. It will just be something you do. And the people who do this, the ones who know these 5 sentences, they're the ones who leave hospitals with their retirement savings intact, and their recovery protected, and their dignity preserved. Everything I've told you today protects you while you're in the hospital, but that's only half your story. What happens when you're discharged to a rehabilitation facility or a skilled nursing facility is where another whole set of traps is waiting. If you don't understand those traps, if you don't know how to protect yourself there, then everything we've covered today only covers 50% of what you need to know. The video I'm working on next covers exactly what happens in those facilities and how to protect yourself during that phase of care. When it's ready, it will find you. And it will matter for your health. It will matter for your finances. It will matter for your family. Until then, remember these 5 sentences. Commit them to memory. Carry them with you. Because knowing what to say in a moment of vulnerability is the most powerful protection you have. I'm Dr. William, and I want you to be safe in the healthcare system.